It's nice to see you all here, and thank you very much for being with us. And I'm very glad that all of you are watching with us, and do hope that you will send questions in as we move along. Hi, I'm Miriam Alexander, and I'm the director of the Mid-Atlantic Public Health Training Center. And I'd like to welcome you here today, and on behalf of the center here and the State Health Department, we are now going to talk today about youth sports through a public health lens. Before we get started, I have a few announcements. For those of you who are watching online, please check our archived grand rounds and all our other online trainings. We have a few spots left in our team building session on June 6th, so I invite you to join us for that on-site training. Our next grand round will be on June 18th, and it'll be on public health advocacy campaigns, how to win with research. For those of you watching online, please do submit your email questions, and you can just email them to maphtc@jhsph.edu. So today we're speaking about youth sports through a public health lens. This is an issue of importance to all of us who are in the public health community, those of us who are parents, and those of us who are sports aficionados. So I do look forward, especially as a parent and a member of the public health community, to hearing what our guests today will speak about. I'm going to introduce both of our guests to you and then let them give their presentations, and then I'll come back and take questions from all of you. First is Dr. Andrew Lincoln, who was here at Hopkins, but now has gone on to better and bigger pastures, who is the director of the Sports Medicine Research Center for MedStar Health Research Institute and MedStar Sports Medicine. He specializes in the epidemiology and prevention of injuries and health conditions related to sports and physical activity. He coordinates research activities for the U.S. Lacrosse Sports Science, a sport very, very dear to my heart as a former Cornelian, though I won't say that to those of you who are Hopkins fans, and also the NFL Subcommittee on Cardiovascular Disease. Dr. Lincoln has a BS in engineering. I guess that's where your interest in contact came from. An MS in biomedical engineering, and his doctoral degree from this school here at Johns Hopkins. Dr. Griffin is the Director of Health and Sports Safety, a newly created position at the U.S. Lacrosse, the national governing body of the fastest growing team sport. I didn't realize that. Previously, Dr. Griffin served as the Chief Risk Officer at the University of North Carolina at Greensboro, creating the new Department of Enterprise Risk Management in 2010. Before that, he was with the UNCG's Environmental Health and Safety Department. His research interests are changing safety-related behaviors of the millennial generation. I guess those are folks younger than us, right? He's a certified safety professional, associate of risk management, and a graduate member of the Institute of Occupational Safety and Health in the UK. He has his bachelor's from Maryland, right here at home, a master's from East Carolina University, and he just recently got his PhD from UNCG in higher education with educational research methodology minor. Dr. Griffin's background includes growing up in Baltimore and, of course, playing football, baseball, and lacrosse, and more recently coaching youth sports. So he'll be able to talk to us from many different angles on this topic today. So I'm going to turn it over to you, gentlemen, and perhaps after you finish, you'll sit here, and then we'll go from there. Thanks.
Good afternoon. Thank you very much. It is terrific to be here, and look forward to an interesting discussion and encourage lots of questions. Here are my disclosures. I'm with the U.S. Lacrosse Sports Safety and Science Committee, the NFL Cardiovascular Health Subcommittee, and the Arena Football League Concussion Task Force. So there's a couple of themes that I'd like to focus on this afternoon. The first one stems from Charles Dickens' quotes where it was the best of times and it was the worst of times. And what we're going to do is take a look at some of the really encouraging progressive developments, I think, in public health as it relates to youth sports. And there's a lot going on, a lot of exciting things, very positive things, and a few things that maybe not so positive that we'll address as well. So keep that in mind. We'll be hitting on these best and worst issues going on. The underlying theme also that comes into play, I think, has to do with an emphasis on winning, an emphasis on competition and intensity. And for that, the person that I tend to think of is Vince Lombardi, the former football coach, who is quoted here as saying, "Winning isn't everything, it's the only thing." And actually, that's the commonly prescribed quote from him. It's actually a misquote from him, but I think it emphasizes, or it's this sense that this is really what we're about, this is what we have to do, and we have to commit ourselves fully and entirely to the sporting activity in order to be successful. So, and that may have some positive and negative influences on our youth sports culture. So our colleagues at the Daedalus Center in Indiana actually compiled this really nice review of some of the benefits of youth sports, and there are many related to so physical health, psychological health, social well-being, health behaviors, and academic performance. So certainly associations between being involved in youth sports and some of these, what we would consider very positive outcomes. We want our kids to be, to have the benefits of these types of outcomes. And whether they're directly related or indirectly related, we may not necessarily understand at this point, but there are nonetheless associations between participation and these outcomes. So that's very good news in that sense. Recently, there's been a lot more focus on emphasis of kind of this public health model applied to the youth sport area of study. And we've done this as well. So this should look very familiar to you as public health practitioners. This is the 5-step model. Really, of course, everything starts with a strong surveillance program. Epidemiology is then used to identify risk factors and then develop potential interventions based on the understood risks, assess the effectiveness of those interventions, and then implement and evaluate the solutions. Returning back to our step 1 of a strong surveillance program. In our area of youth sports, I think we do quite a good job of surveillance. Some room for improvement there. We have some practitioners doing an excellent job on risk factor identification and then developing the solutions. And then we kind of fall short, I'd say, when it comes to assessing the effectiveness of those solutions and doing the evaluation. And we'll get into the reasons for that following here. So currently, if we look across the landscape here in terms of sports injury surveillance systems, the NCAA does a very nice job of collecting injury surveillance across the universities and the academic sports programs there, but we're really focused on the younger groups here. So if we look at the high school student athlete, there are a couple of systems which have been used recently pretty effectively to document the incidence and trends of different injuries. The Fairfax County Public School program has been used to collect electronic health information and has been a source of a number of investigations. Also, the RIO program, the Reporting Information Online, that Don Comstock's group has developed over the years, is federally funded, stratified sampling technique of 100 high schools across the country where they have athletic trainers. And really, that's about where it ends, because in youth sports, well, we're in all sports, we're largely dependent on good quality for our surveillance systems. And that quality data stems from having athletic trainers in place, not only to do the initial medical evaluation and management in collaboration with team physicians, but they also do the vast bulk of the data reporting and collection. And currently we have very few or very little degree of participation of athletic trainers at the youth sports level. And so that's really limiting and hamstringing us in terms of being able to collect good data. I'll mention there is a study underway currently that's funded by USA Football. They're finishing the second year of that study, so they have yet to actually publish the results, but this is a nationwide sampling around 10 municipalities around the country, and so they'll be publishing the results from their study. And this is an application where they've actually used athletic trainers at youth, in youth leagues around the country to determine injury surveillance at different age levels and types of play. But that's really the beginning and the end at this point, because of what's required to do that. It's one of our infrastructure limitations at this point to better understand youth sport injury incidents. I think one of the other really strong positives that's been coming out recently is the involvement of the legislative aspect in terms of the public health and raising awareness. So this slide documents the different states that have now passed youth sport-related concussion education laws around the country. These are often known as the Lystat laws, named after Zachary Lystat, who was a middle school football player in Washington State back in 2006, who sustained a concussion in the first half of a game. He went back to play later that game, was hit again, and sustained a severe injury, a severe brain injury known as second impact syndrome. And a lot of the medical community kind of looked at that situation with Zachary, who's now a very strong advocate for concussion awareness, but still it will likely have lifelong brain injuries to deal with. So they looked at that case and wondered, how is it possible that we're allowing this to happen in our youth sports environment, that a kid can have a concussion and go back into a game, be allowed to go back into a game, and is at risk for this severe of an injury. So with that motivation, the first Lystat law was passed in 2009. And as you can see from the gradations across the country, various states have since passed state laws that have different degrees of components and different degrees of requirements. But at this point, just a couple months ago, I think Mississippi was the last state, and we now have all states in the District of Columbia who have passed legislation. Typically, the legislation includes three primary elements. The first is awareness and education training. So every youth participant and parent or guardian must do some type of education or training on the signs and symptoms to better recognize concussion. The second is the provision that if there is a suspected concussion, that player is not allowed to return that same day to the practice or contest going on. So they have to be removed from play. And third, they cannot return to play until they're evaluated by a medical practitioner with expertise in concussion management. So not every state is the same. There's a lot of variability, but those tend to be the three primary elements in these states. And we believe the Lystat laws have really been kind of a landmark example of kind of public health education and raising awareness around the country. Also, public health campaigns as they relate to youth sports. The NFL Play 60 program is something that people are probably familiar with. The NFL certainly takes on a major effort of promoting the Play 60 movement campaign, trying to get kids out and exercising 60 minutes a day. So similarly, now we see the National Basketball Association has come out with their NBA Fit program to be active, to eat healthy, and play together. So these may not necessarily be formal or structured or organized sports as much as it is general play, but it is related, I think, to youth sports. And then, of course, we have the First Lady's Let's Move campaign, again, to try and promote physical activity, perhaps as much related to the fight against obesity and childhood obesity as it is to promote, say, sports activity in itself, but they are definitely linked. Perhaps the crowning jewel in the, I'd say, public health education campaign has been the CDC's Heads Up program, designed to get the word out on concussion awareness and signs and symptoms. And I realize it was kind of a shock to me that it's been out for 10 years, 10 years since I first received this Heads Up concussion kit. And this was the first one that was designed to educate high school coaches on signs and symptoms. And at the time, it was really kind of a landmark direction for them to go into. And they've, I think, just done a rather amazing job over the 10 years of developing materials, disseminating them in different formats, working with a variety of agencies, private groups, public groups, to develop, in this case, apps that parents or a coach, a rec coach on a sideline can have on the sideline to get a sense of whether a kid may have sustained a concussion. So again, a variety of partnering approaches, a variety of media approaches. They have their own YouTube channels and those types of social media they've explored, and it's just boomed in different directions. And again, so I think in terms of education and outreach, it's been a tremendous success. I'll go ahead and discuss a few examples of some evidence, best practices, and consensus statements that have been put together recently on just a couple of different topics in youth sports. Well, the first is going to be ACL injury. This is the knee injury, which is of great concern really for three reasons. The incidence is quite high, and unfortunately our female athletes we know to be at increased risk compared to our male athletes. But with many of the soccer teams and other teams, it's not unusual to have one or two players who have experienced this devastating injury. So incidence is high, severity is high. It is oftentimes a life-changing injury. It's an injury that at this point we only have about half of the injured players are able to return to the same level of play. And that return is likely to be a year or more after the initial injury. So it's a long road back. It's a lot of rehabilitation. It's a lot of medical expense, both direct and indirect medical costs going on. And then it also puts these patients at risk for development of osteoarthritis down the road. So prevention of ACL injuries has been, of course, one of the really big areas of development over the last decade or more. So we'll look at an example of a program that actually has demonstrated effectiveness. Another topic is something called commotio cordis, also known as concussion of the heart, which is a situation which is fortunately very rare, where a small projectile might hit an athlete right over the heart, and if it happens to hit it the right place at a very small time point in the cardiac cycle, it can actually cause an arrhythmia in the heart, and the heart will stop, and it can be fatal. Again, it's very rare, but we're looking at preventive opportunities for that injury. And then lastly, we'll talk about some head injury or concussion developments recently. In youth sports, or even more broadly speaking, across all sports, a randomized controlled trial is a very, very rare thing because of the difficulty of actually being able to organize the logistics to do such a thing. But this was a study done in Africa of male football players, or soccer players as we know them, where they tested out the FIFA 11 plus warm-up program. This was developed by the medical group associated with FIFA, the world organizing body for football or soccer, where they came up with 11 different exercises, and this just shows a few of those exercises here that would replace a team's traditional warm-up activity, where they're emphasizing some strengthening, some balance improvement, some, what else? Some plyometrics are also some of the key elements involved with these training programs. And so what they did was created two very large groups of these youth players and evaluated outcomes in terms of all injuries, lower extremity injuries, and so forth. And for all injuries, game-related injuries or match injuries and lower extremity injuries, they all proved to be very effective with rate ratios down around 0.59, 0.52, and statistically significant. So this is a rare example of a randomized controlled trial that is shown to be effective for this FIFA 11 plus program. Looking at the commotio cordis issue, again, this is a figure where Dr. Mark Link, who's done a lot of the groundbreaking work in this field, in his recent review paper, he identifies the situation occurring where a baseball, or it could be a lacrosse ball, a hockey puck, but some small projectile hitting the chest wall over the heart and causing this arrhythmia, again, oftentimes fatal if there's not an AED available immediately at the site. In his table where he lists a number of different preventive approaches across different sports, including lacrosse, baseball, and hockey, I was particularly interested in the different categories of preventive activities, because if we think of this from a public health perspective, these are really primary, secondary, and tertiary interventions. So avoidance of the chest wall impact by coaching techniques or rule changes being our primary prevention. The chest protector, and where we're actually trying to understand right now how effective chest protectors that are on the market actually may be or not be for this. And then the AEDs as the immediate post-injury treatment to prevent death. So this is very much going along with the public health approach. So, of course, head injury and concussion has been a very prominent issue, and one of the biggest, I'd say, questions going on out there is whether or not helmets can be effective in preventing concussion, or even maybe not preventing, but reducing the risk of concussion. So this is a paper that came out just in the past month by a number of investigators around the country that involved 10 different football teams, college football teams, over the course of a 6-year period, involving over 1,800 college football players, where they looked at impact data, where they were using 2 different Rydell helmets. So they looked at several different outcomes. They looked at clinical outcomes and biomechanical outcomes. The bottom line from the clinical outcome was that the relative risk of sustaining a concussion in a Revolution helmet, that is the newer design helmet, compared with the older design helmet, was 46%. So over half of the concussion sustained would have been, would not have occurred. It would have been protective in that sense, and the confidence interval suggests statistical significance. So that in itself is a huge finding that, and really opens the door on the discussion of how effective a helmet can be in reducing risk. They also looked at some some mechanical data, some drop test data in the lab, and as this graph denotes, so whether dropped on the front, side, rear, or top, the newer helmet, the Revolution helmet, tends to impart lower acceleration values than does the older helmet. They also presented a graph using those college football players over the study period, where they stratified them by position and looked at the 99th percentile head accelerations according to which helmet they were wearing. And I thought this was a very effective way to demonstrate that the newer helmet, again, the Revolution helmet, was associated with less acceleration being imparted, well, ideally to the brain, to the sensors at least, that were inside the helmet to detect the forces. So that's pretty consistent across all positions. And you'll note that there's a dramatic difference really in the level of the impact, which is related to the amount of kinetic energy involved associated with different positions. To some degree, how much of a running start do they get? How much speed do they have on contact? Or to some degree, how much speed does someone who's hitting them have, say in the case of a quarterback? I think the next in the very positive news regarding youth sports was the report that was disseminated by the Institute of Medicine and of the National Academies on sport-related concussions in youth. Obviously, there's been a lot of media attention, and there's been a lot of legal activity in this area. So Fred Rivara and his colleagues put together a really excellent resource here, which documents kind of where we are at this point in terms of youth concussions, or sport-related concussions in youth. And there's 4 primary recommendations that they have. The first one is the need to chart the unknown. And this goes back to the fact that we do not have a surveillance system to be able to document what the rate of youth concussions in sports is at this point. And so going back to step 1 of our public health model, that's where we've got to start. And we've got to have good data to go from there. Secondly, understanding diagnosis, recovery, and health effects. That is, how does the brain change following concussion? And does it change differently for girls than it does for boys? Does it change differently for our toddlers than it does for our adolescents? We still have so much to learn in this, and those answers also are going to affect the approaches that we might take in terms of prevention and treatment. Thirdly, improving the safety standards and equipment design. This is, again, where we struggle with the effectiveness of knowing how different techniques and rules and playing and practice standards may benefit our youth athletes, how it may vary across age and, again, across gender. So a lot of work to do to better understand what's useful and what's worth kind of the cost of implementing these different strategies. Lastly, something that addresses the culture of youth sports, something that I describe as kind of a self-sacrifice versus self-reporting. For a long time, I think our youth are more or less acculturated to a self-sacrificing mode, so that if they're hit and they're hurt, they tend not to want to report it. They don't want to come out. They don't want to lose their spot. They want to be there for their teammates. And so this really addresses the need to change that approach and be much more willing to report when they're hurt. So a follow-up from the IOM report was a letter that came out just a couple weeks ago from Congress, which actually makes the, formal request to the director of the CDC to implement a national injury surveillance system to accurately determine the incidence of concussion, including sport-related concussions in youth. And I wanted to share this because this could well be a change in the infrastructure, at least from a public health standpoint, and allow us to get much better data and information to base our programs on. Wanted to mention another program which is now being widely distributed across the country, which is USA Football's Heads Up program. This is a program which focuses on a change in technique to avoid the head and focus on initial contact with the hands. So it's a very different approach than what we see in the professional game. It's something that's being taught to coaches really around the country now. And also in the past month, the Maryland Public Secondary School Athletic Association became the first state to officially support this program, so that they will be sending a coach from each of the high school teams, the public high school teams, to get training in this technique. And I think it's a step in changing that culture, but also changing technique. Now, from a public health standpoint, we recognize that this is an active intervention. It requires the players to change their behavior and how they approach their opponent and try and tackle them. It's not going to be easy, and I think a thorough evaluation of how well these techniques are being taught to the players, how long-standing those techniques are being used, and whether it's actually making a difference will be incumbent upon us to follow through with, and hopefully we'll find good results. Okay, we're going to move a little bit from all the good news to a little bit of the bad news, perhaps. I'd like to share with you kind of an example of an experience in a youth football league in Texas. This has been documented in the recent TV show Friday Night Tykes. So I don't mean this as representative of youth sports in general or of youth football more specifically, but I think it is something that we ought to be aware of as we consider the kind of the playing field of youth sports. So bear with me 1 second.
Esquire Network presents a sneak peek of Friday Night Tykes.
You had the opportunity today to rip the...
Oh, sorry.
Tonight, there's a war in my kitchen. Two chefs are going head-to-head.
Esquire Network presents a sneak peek of Friday Night Tykes.
You had the opportunity today to rip their freaking head off and let them bleed. If I cut them with a knife, they're gonna bleed red, just like you. You go out there like junior Broncos, you play junior Bronco football, and you can do it. If you believe in yourself, you can do whatever it is you want to do in life. Do it now, though. Do you understand?
Yes, sir.
Do it now. 1, 2, 3.
This is the Texas Youth Football Association, one of the elite football leagues for kids in America. And the 8- and 9-year-old rookie division in San Antonio features the best of the best.
Hey, give me that soft crap. There should be no reason why y'all don't make other teams cry. I could care less if they cry.
The teams are ultra competitive, demanding commitment.
This is where you earn your
sacrifice and intensity.
You can do this. You are stronger than this.
It's hard.
5 teams.
We come out screaming and yelling.
5 heated rivals.
Oh, we gotta fight! We gotta fight!
Only one can win.
You're so worried about winning that you're not playing.
I don't care how much pain you're in. You don't quit.
You guys forget that they are babies.
If that kid comes across, I want you to put it in his helmet. Do you understand? I don't care if you don't get up. Let's go.
Friday Night Tykes premieres January 14th at 9 on the new Esquire Network.
Okay. So that's obviously a pretty extreme position that we see there, and a lot of concerns, I think, from the exposures that these kids are being asked to be involved with, and whether or not that's a healthy thing from a number of perspectives that we want our youth involved in. So plenty of room for discussion there. I think something that's come up somewhat recently is the recruitment of our young players to big-time athletic programs. Here we've got a clip from a 13-year-old who was recruited and signed a letter of intent to play lacrosse here at Johns Hopkins. Whether or not 13-year-olds really should be in the position of having to decide where they want to be spending their college years is something we can talk about. And I think everyone's kind of in the situation where that's how the system works at this point. The coaches aren't necessarily wanting to be involved in that, from what I understand, but they also don't want to lose out to their competition. So it's a difficult situation for everybody. So again, talking about some of the mental health aspects of sport participation for our kids, this is something that's very well presented in a book that came out a couple years ago by our colleague Richard Ginsburg on the U.S. Lacrosse Sports Science and Safety Committee, where they're examining a number of different aspects of, is sport participation going to be a positive experience? Who is the child participating for? Are they doing it for themselves? Are they enjoying it? And so forth. Is it fostering a healthy competition within them? And then what kind of positions does this make the parents consider, and what kind of quandaries does this put the parents in about the amount of energy and effort and time to devote to a youth sport endeavor, and kind of what's the right amount for different families and different kids? So I'll leave you with those questions, and I'll turn it over to Dr. Griffin.
Thank you, Andy. So start it. Well, again, thank you, Andy. So if Andy's the researcher and the sports researcher and the leader in the field, I might be the practitioner in the field. And I work very closely with Andy. He's on our Sports Science and Safety Committee and has given U.S. Lacrosse a lot of guidance and leadership to actually create my role. I've only been here about a year and a half. It's a brand new role. It's a brand new role in sports leadership and in national governing bodies. So just a little background on the size of youth sports. It's estimated that there are 44 million young people in organized sports. That's, organized sports on teams. We know that there are about 800,000 youth lacrosse players. And youth lacrosse and lacrosse in general is actually one of the fastest growing team sports in the country. It's probably the only growing sport. Over the last 10 years, it's been growing 7 to 10% a year. So while it's traditionally been kind of Mid-Atlantic, Northeastern U.S. sport, it's taking off across the country. And so that growth presents some issues. A little bit of background about lacrosse, because it is not widely known in all parts of the country. It was a Native American game called the Creator's Game. It was played for centuries on this continent. In the 1850s in Canada, a dentist actually wrote down the rules. Canadians started playing it in the 1840s and 1850s. They finally wrote down the rules, and there was an athletic club that they started kind of being more formal. The men's game grew in Canada and in the Northeast and the Mid-Atlantic region of the United States. Differently, the women's game, which has become a different game, grew and developed in Scotland, and then also in the Baltimore and Philadelphia areas particularly. So the rules that were the same started to diverge in 1933. They made significant differences. If you've ever seen a game now, the differences are primarily related to contact and equipment. So in the men's game, they wear helmets, a lot of pads, gloves, and full body contact, checking, hitting. In the women's game, they don't wear helmets or typically any padding. It's more of a finesse and speed game with no contact, more incidental contact. And then kind of just to understand the differences in the game, this is from one of Andy's studies actually looking at youth sports. The injury rates are significantly higher in boys lacrosse than girls. And if you look at different levels, as Andy mentioned, there are more studies in the high school and college level of play, and the numbers become a little closer, but typically the numbers are higher for men's, the higher incidence rate. I think Andy addressed this bigger, but I just had to say, why do we let kids play this if there's injury rates and risk? But there are plenty of positives. The childhood obesity as a public health issue. An interesting study I saw where they looked at World War II veterans. The biggest predictor of physical activity at the age of 70 was being a high school athlete. So, if you want to be active and full of life in your golden years, physical activity at a young age is a good predictor. And then, of course, the CDC has, many of the things on their website that say what we all believe. I think that sports are a positive or can be a positive experience for kids. There's personal growth opportunities, being part of a team. And I think the biggest, most important thing that, Andy mentioned parents having this quandary, but I think the most important thing is it should be fun. I was very fortunate. My son's in high school now. When he started playing lacrosse, part of the reason I'm involved, because the first time he played, he came off the field with this huge smile on his face. And, when you see that, you say, this is a good thing for my son. So when adults involved in youth sports are able to make that happen, I think it's a great experience for kids. I want to talk, so where I work is at U.S. Lacrosse. It's a national governing body, and I thought it'd be interesting for practitioners and people in the field to understand that there's not a one-size-fits-all in national governing bodies, and youth sports and even all levels of sport are fairly complex and governed differently. You might think that as a national governing body, it would be easy to just say, let's change this rule, and then it just gets enforced across the country. But as we know, that doesn't even happen with legislation. So in a looser confederation, such as a sport governing body, it doesn't happen quickly either. So NGBs, national governing bodies, have a variety. There's different types. So Olympic sports actually are probably the most legislated and controlled in the country. So there was a Ted Stevens Act, which modified some of the Olympic legislation that created the USOC. And so those sports actually have some legal requirements. They have a monopoly to create a federation for their sport. So a sport like hockey, it has, and soccer even, or hockey particularly is an Olympic sport. So they have a mission as USA Hockey to develop national and elite teams. But then they happen to have an interaction with youth sports too, and same thing with swimming. Traditional sports like football, let's take for example, there is no national structure or national governing body for football. Each league, each area can create its own rules. They're written, the NCAA writes rules, The NFL writes rules, arena football so everyone writes different rules. In the youth world, there's Pop Warner football, which has a large population, but there's a lot of things that are just run locally. So, someone can't just, there's no national governing body that just mandates and makes things happen and change. And then growth sports, like I said, lacrosse is a growing sport across the country, which has other unique aspects to it. So this organization was founded in 1998, trying to pull together some of the variety of groups that were running lacrosse as a sport and trying to get it as uniform as it could be across the country, just to kind of promote growth. I'll talk a little bit about U.S. lacrosse in general. It's a national structure, but it has regional chapters to try to govern across the country, so it's regionalized. And the organizations that benefit, again, there's local and state youth leagues. They're pretty independent. They run themselves, and they rely on U.S. lacrosse for some things like rules and governance, or the research and efforts that Andy makes. There's club teams from youth to grandmasters. People play lacrosse into their 60s. So it's a cradle-to-grave sport, hopefully, and that's something that we encourage, lifelong activity. Then there's state high school athletic associations. So each state, they're confederated into the National Federation of High Schools, but each state has its own group of, sometimes two, maybe one for public high schools and one for private. So they have their own high school athletic associations that set the rules for their own state. And then there's college, varsity, and then there's also club in lacrosse. So there's a lot of people playing at the NCAA level and in college. One of the things that U.S. lacrosse, I think, separates it from other national governing bodies, and hopefully one of the reasons that we're here, besides being headquartered in Baltimore, is that we have a sports science and safety committee that was developed early after the founding of the organization. So in 2000, a couple years after it was founding, the leadership decided that keeping the sport safe was important for its growth and for the quality experience for the athletes. We have full-time professional staff, which is me. So it's one of the unusual things in national governing bodies is that there is someone who's dedicated to sports safety. It involves a lot of different things. It also involves risk management and public health and a variety of other roles, but it is unique for U.S. lacrosse to step forward and take that leadership role, and I think other national governing bodies are looking at that as a model to kind of take control of the health and safety of their athletes. We have the Sports Science and Safety Committee, which has literally some of the world's experts in medical, clinical, and research, and in the sport itself of lacrosse. It's a great group of people to work with. It was interesting that a lot of the slides that Andy showed, a lot of the research, I noticed a lot of the names on there because I work with them on a daily basis, a lot of the authors. So it's a great group of people. They meet often. They have a medical sports medicine symposium every couple of years. We also fund a lot of pilot studies. This year, U.S. lacrosse is spending about $200,000 in pilot studies across the country. One of the great ones that we talk about a lot is at Princeton. One of our researchers is using accelerometers on boys or men and women, I guess, at that age, and trying to understand what happens through the course of a season to the head. What are the accelerations that they experience from collisions or just movement during the game? So just understanding that basic science. We're able to fund a pilot study, so to speak, and then hopefully that'll grow into a bigger study and get funded by a larger organization. How does lacrosse, or really this is somewhat unique to the sport, but many organizations across sports, youth sports and high school sports, have rules governing bodies as a big part of what a governing body does. So how lacrosse has decided to look at rules, particularly related to safety, not so much playability or fair play, but particularly safety, is to ask researchers. The reason we have the Sports Science and Safety Committee is that they are able to answer the research questions for the people in the Rules Committee. The thing that's hard, though, is that like I said, other people have ability to alter rules or write rules. So U.S. Lacrosse, for example, writes the rules for youth sports. It writes the rules for girls' high school sports, but the boys are written separately. And the NCAA writes its own rules, but they listen, somewhat to the research from our Sports Science and Safety Committee to make that. But then people locally can just decide that, and it's unfortunate, I've seen this, that they feel like it's more important for their children to maybe experience the NCAA rules when they're 10 years old, and it's okay for them to have full body checking and things like that, which we think is inappropriate for people that young. Another big thing that we do, and we believe that, as Andy was talking about, is behavior change, is the education or certification of coaches and officials. That's something that U.S. Lacrosse has spent millions of dollars developing online programs. You can see that coach education, there's 3 levels of it, so people progress through this. They're able to, it's game specific, so there's boys and girls, and then they're able to take an online test in education, classroom, skills component. It's a fairly rigorous effort, and then they also get the positive coaching component, which is being a good adult in a children's game. Officials go through the same thing. They have online and on-field evaluation. Equipment is an interesting part of the game when there is equipment in a sport, and typically it's done through national standard setting organization. NOCSI is the organization that develops standards for a lot of protective equipment in sport, football helmets, lacrosse helmets, lacrosse balls actually, and another body is ASTM International, which is the American Society of Testing of Materials. They develop a lot of sports equipment standards for equipment, for everything from curling helmets to equestrian helmets and eyewear for women's lacrosse. That has also kind of one area that we've spurred some research in, just trying to look at better equipment, and NOCSI funds a fair amount of research in that area also. And then actually, the design and manufacturing firm, there's a lot of money being made in sporting goods. There's a Sports Fitness Industry Association, and those folks work hard to produce good products. There's tremendous liability in those products, so they are very thorough in their research and design. How are we on time? Okay. I just want to run through a couple of strategy examples, some examples of things that we've done at U.S. Lacrosse and kind of the practice of using all these tools in a public health area to make the game safer and improve outcomes for the athletes. So concussions in men's lacrosse. As we said, there's a higher incidence rate in men's versus women's lacrosse. Some of the research that came out of the Fairfax County studies that Dr. Lincoln, Dr. Sheen Caswell, Lisa Hepburn, and John Almquist, some others, some groundbreaking research over 2 years linking using video and reported concussions on the sideline. So there was athletic trainers on the sideline and video being taken of the game. They were able to pair it up and actually have video of concussions occurring in the game and then analyze them and see what led to the concussion. And what they determined was a large percentage appeared to be from defenseless hits. So where the player didn't see the hit coming, that seemed to increase the likelihood of a concussion occurring from body-to-body contact. That occurred, the research was published probably a year and a half ago. I started at U.S. Lacrosse around the same time and was fortunate to be able to have some brand new research and take it to the Rules Committee and sit down with the Men's Game Rules Committee and say, look, this appears to be something that's causing or increasing the risk of concussions in our game. What can we do about it? The interesting discussion was sitting down with these folks who are officials or leaders in the game, and they said, what can we do? Let's change the rule, and if there's a defenseless player hit, let's make it a penalty, and then increase the severity of such a penalty. They changed the wording, and they also made it what's called a non-releasable penalty. So in lacrosse, when you get a penalty, if that just increases the severity, because if you get a penalty, a person is taken out of the game, a player's out, and then the offensive team is likely to score several goals while the other team is a man down. So making it non-releasable is a big deal to the coaches to try to change behavior. They also increased it to 2 minutes, which is like, almost the death penalty in the game, that you're going to give up 3 or 4 goals because if this occurs. It was interesting, though, the conversation that I'd never been exposed to, but they were afraid that if they made it too severe, if they went to 3 minutes, that officials wouldn't call it. So that kind of, you think you just change the rule and it happens, but as we know, there's a lot of behaviors that have to follow suit. And if it was too little, it wouldn't serve as a deterrent. I saw it this year. I saw it called in one of my son's high school games, and I saw the coach. I was happy that our coach was, instead of saying good hit or anything like that, he took it as a teaching opportunity to teach the young man that was, unnecessary, could have hurt the other player, etc. So when you see those things, you kind of feel like maybe the rule adoption and implementation is starting to work. But we know it needs a couple years to happen. It has to be adopted across the country, and people have to believe it's the right thing to do. So there's kind of a public health education piece that goes along with that. And then, as Andy said, potential success and need for more data is probably one of the biggest things we have a problem with at lacrosse, and I think, as Andy said, in all sports. The IOM report had some great things in it, and the 4 things that Andy saw, I saw in it also. But the national injury surveillance, man, that could be a great thing for how sports are played in this country. And it's focused on concussion, but it would be great if it was a little bit broader. And so, something like that could really serve our youth well, because we could really find out what interventions are making differences and what things aren't. The other way to measure success, as Andy said, there's the NCAA and NFHS data. There's data at the above 15 level, but for the U15 level, there's just not a lot of effort. And finally, I think the other way that I measure success is the number of phone calls that I get from parents. Either they're positive or they're negative, and that's the practitioner role that drives, me to seek strategies. I think another thing that we're working on, another example, again, is public health education. There's head injury in both games, and there's a lot of parental concern. And they want better helmets, or they want helmets on girls, or not sure what the interventions could be. And I think it's incumbent upon a national governing body like us, or in all sports really, to help the parents understand what is important for their child, to make them better consumers. As Andy mentioned, there's Heads Up resources, there's Heads Up Lacrosse and CDC, and we want to focus on educating parents and getting them to understand that maybe 3 actions can really help make their child's experience better and safer, which are having certified coaches, certified officials, and using the age-appropriate rules. Don't let them play the Major League Lacrosse rules at 10 years old, where they're just a lot more hitting and things like that. So we're trying to develop such a thing, a public health education. We're actually using the pink book from the National Cancer Institute to kind of as a model, and using it step by step to kind of develop this program. We hope to, empower consumers and empower parents to advocate change. One of the sad things in that Friday Night Tykes video, I think, to me, was some of the parents, if you've ever, I watched an episode, you can find the whole episode online, and it's pretty shocking to see a parent, yelling at their child and imploring them to just do crazy things, and so hopefully we can help reach out to those parents and maybe help their children a little better. And then a third example is related to the ball. So I mentioned that NOXI is a standard-setting organization, and so when they started to set a standard for lacrosse helmets, they had to understand, they had to set a standard for a ball, because they couldn't shoot a ball at it because the balls were variable. I mean, you never think about this, but there was just, you have a hard ball, and that's what you play lacrosse with. It's not like anyone had ever developed standards. So they developed a standard for the ball itself, and then they used that standardized ball to test the helmet against skull fracture. And so a couple years ago, a young man was injured in the Northwest, and a ball straw cracked his helmet on a shot. He was taken to the hospital, was almost released, but was then fortunate for some reason. There was an intervention, and an MRI revealed that he had a brain bleed, and fortunately was saved. The parent reached out to U.S. Lacrosse and said, I thought this was supposed to happen. I thought that's what these helmets were designed for. So, and they also reached out to NOXI, the standard-setting organization. So kind of in a collaborative effort, took some of the balls that were being used in that setting, the helmet, the same model, and tested it. And what they found out was the balls were out of spec. They were much harder than they had been specified in the, that they were used as a test standard. And there was kind of the further thought was, the rules just said use a lacrosse ball, kind of in various forms. Maybe it said if it drops and bounces this high up, that's good enough. And so U.S. Lacrosse kind of tried to gather all those different people, the NCAA, the NFHS, U.S. Lacrosse youth rules, and say, hey, let's get a ball that meets the specification, and let's put that in the rules. So it's been very successful, actually. This year was kind of the drop dead date was January 1st, but over a 2-year period, the rules were changed and people were kind of, hey, this is coming, change, make sure you're using these balls. They're safer because there's some consistency in specification. So that's just another example of how rules can change and how national government bodies can make sports safer. That's my contact information. And I think we're ready for questions, if there are. You have to join me.
Could you just go to that microphone, please? Just so that it gets recorded in the webinar. Please, for all of you watching, feel free to send in questions here to this email address, and we already have quite a few questions here. Please, go ahead.
I was just curious, actually. I'm a public health practitioner, but I'm also a lacrosse coach and a former lacrosse player. And I do see the issues, and I noticed some of the changes in the game is getting safer, and I feel. But I feel that a lot of the time, a large issue with the youth programs are the parents, and where we require your coaches to take certifications and our officials to take certifications. Are there requirements, or are there any kind of like contracts or anything that can be set up with parents, or are they required to actually do these educational tools, or is just suggested?
I can answer that from a lacrosse perspective. I think one of the things that we're working on very hard is developing some parent education programs. We work closely with an organization called Positive Coaching Alliance, some great information, some organization out of California, and we require that as part of our coaching certification. And as our best practices we're developing, called gold stick standards, we're developing for leagues and organizations, we would like them to require parents to go through that. The league my son first participated in North Carolina had a requirement that parents go through a Positive Coaching Alliance meeting in a room like this, and you got $5 back on your registration fee, and I think it was very successful. And so there's not really a requirement, but it is strongly recommended, and we're working hard to change behavior to get folks to understand that they have an important role to play in their child's experience in sports.
Is there, just to follow up with that, is there also any resources available to the coaches who do encounter parents that are problematic or disruptive in that fashion?
There are a lot of resources on our website for lacrosse particularly. And we actually kind of have a program too that we recommend to leagues. We work with the league administrator to try to convince them to go to these gold stick standards. And one of the things in there is having a sideline manager, having a responsible parent. There's a program and some guidelines that we've developed so that as a best practice, if the league wanted to follow that, it would be great.
Thank you.
Yeah, thank you.
But going along those lines, you're speaking about educating parents, and often you need a penalty on the other end. And certainly in my experience as a parent, I think I've only seen, and only in games, parents probably kicked out twice. And I mean, there's grossly egregious behavior going on in public, so can one only imagine what's going on in those homes?
That's one of the things with the sideline manager program is to hopefully empower so many the responsible parents, so to speak, on the sideline to kind of use a little peer pressure, because it's not typically the entire. It's usually one or two persons, and it's kind of like they're the silent majority sitting there not saying anything, but they wish they could just say, hey, cool.
Get out of here. Anybody else have questions? Okay, so there are some questions that have come in. I want to talk to you about helmet design and ask you a little bit about what helmets look like compared to, in sports in general, compared to motorcycle helmets or race car driver helmets, if they're all based on sort of the same principles.
Okay, yes and no on that. In that helmets in general are designed for the purpose of preventing the skull fracture and a brain bleed, if you will. So the very most severe head injury events are what they're designed to prevent. The issue of designing to prevent concussion is not part of the design criteria, largely because we're still trying to understand what is that criteria it's very, there's a lot of variability in what causes concussion, and thankfully, the incidence is quite low in terms of, based on the large number of exposures, relatively few concussions occur. That said, it can occur at high levels of impact or low levels of impact, and there's a host of different risk factors that go into what might be associated with that. But individual sports develop their own standards kind of based on the exposures and the risks. So I think
the other thing is the other thing too is the single use versus multiple use. So a bicycle helmet particularly or auto racing, a lot of those are single use designs. So they're designed to disperse energy through destruction of the helmet itself. And so in a sport it may not be able to. And I think that further, so one of the things that U.S. Lacrosse is working on is in the game of women's lacrosse, they don't wear any type of helmet. But we are going through a design process with not really design, development of a test standard through ACM to look at what might be appropriate. Well, you wouldn't take a football helmet and put it on someone playing lacrosse. So you have to look at the risks in the sport because it's different. So we actually had a researcher looking at having women swing sticks at heads and see what those forces were, measure those forces, and then also understanding the speed of the ball, and then developing a kind of a test mechanism to simulate those two impact forces, and then a design can be made from there.
Coming back to that point, but also the issue of a concussion, what causes a concussion? Is it an acceleration, deceleration?
right. So it's the trauma induced to the brain from the impact to the inside of the skull. So it's the rapid deceleration of the skull. So again, it's kind of that internal injury rather than the external force itself. At least that's as we currently understand it, and I would say that even that is evolving quickly. A few years ago, there were experts who would say that it would be impossible to experience a concussion based on a stick-to-head impact, only because there's simply not enough mass for there to be enough kinetic energy involved in that energy transfer resulting in that. And that was actually one reason that we did the video analysis study that Bruce mentioned, was to really identify, okay, we understand that these injuries are occurring, but how are they occurring? And we found that about in half of the girls' lacrosse concussions, they resulted from this incidental stick-to-head contact. And watching a lot of them, you'd notice that, these were not huge swings and really what you would consider super dangerous play or anything like that. They seemed rather incidental contact and at relatively low levels. So that's part of what the standards development group is taking into consideration in the design. We don't need to, it's not like football where you've got a player running 60 yards down at full speed and launching themselves at someone. This is a light stick. And so that is the primary mechanism that is being designed for.
I would imagine that until the NCAA changes standards, youth standards may not change as much. How does the NCAA feel that they fit into all of these issues of youth sports?
I think it varies by sport. Again, I can speak most directly to lacrosse, but lacrosse NCAA rules are developed by coaches. And so that's just the way their committee is structured. And so they're looking at the game and how it's played and not so much maybe the safety aspects. I shouldn't say that. They do look at the safety aspects, but maybe not in the same perspective because they're doing it for adults almost, 18 to 22-year-olds playing the game. And actually, we try. I think there is actually, in our case in lacrosse, I think the youth rules are actually are driving somewhat the adult rules. The research is being done through our Sports Science and Safety Committee to look at particularly what what is appropriate for a 13-year-old. And when we started looking at contact and the defenseless player hit, that actually went from US Lacrosse up to the high school. It hasn't been incorporated into the NCAA rules yet, but I believe it will be.
It'll go that way. Well, going to that point, how did Johns Hopkins get away with recruiting a 13-year-old?
I think part of it is, it's a verbal commitment, so there's kind of and I think that, there's an arms race, so to speak. Everyone wants the best players, and they are going younger and younger, and it doesn't just happen in lacrosse, it happens in football and other sports. And actually, part of the rules are that you're not allowed to talk to an athlete until after his junior year. The coaches aren't actually allowed to physically talk to them, but they talk to them beforehand, They're at younger recruiting events and tournaments and things like that. And so these players that are super physically mature at 15 years old or 14 years old or sometimes even 13 are, kind of like, he's the next thing, and they want to lock him up, so they have this verbal commitment. Unfortunately, it's verbal. There's nothing in writing, so it can change. If an athlete gets hurt, if a coach changes, there's a lot of craziness to it. You think about a young man who's making a decision for 4 years down the road, or a young woman, and they're making a decision that coach may not be there. How would they even guess what their major might want to be, what they might want to study in college?
Or what kind of a person they might be in 2 years when they're 15,
exactly,
or whether they're still interested. What are Dr. Lincoln, you went through the state-by-state laws. What are the penalties if schools don't follow them?
I'm not that conversant with each of the states, but my understanding is that there are no penalties in any of the states. These are simply voluntary recommendations of what ought to be done. There's no consequences or teeth or penalties if they're not being done. But it's the standard of care that's trying to be fostered through these. And I believe it has increased, awareness of concussion signs and symptoms has increased over the last few years. Whether or not that's directly related to the laws, related to the CDC campaign and the media attention and all these other things, or maybe some confluence of all these things. So I think that's the good news. Parents are better at recognizing it, and the kids are better at recognizing it. I think the other side of that coin is that although they're better at recognizing it, the kids also realize that they will now have to be out for a week, maybe 2 weeks, maybe longer. And so a lot of them will be reluctant to report a sign or symptom. They'll stay in the game and they'll hide it from their coach. So to some degree, the downside is that we're driving it underground in terms of the reporting. And so that goes back to how do we change the culture?
I certainly see that. I'm sorry?
I have a question.
Oh, another question? Go ahead, please.
So just wondering, we have a question about educating referees, or what is being done to ensure that referees are making proper calls. One person writes that they see a situation where aggressive behaviors are ignored or possibly not understood as a foul hit. So how are referees being held accountable for these non-calls?
I'm not sure that they are being held accountable for that. And I think there's a growing discussion about what is the role of the official as it relates to kind of a health and safety perspective. So traditionally, I'd say the officials are not given that responsibility, or have not. I think that may be changing at this point, and whether or not we foster officials in their role to have more of a protective an active role in identifying players who may be hurt, may need to be checked out, is a bit of an open discussion.
Yeah, one of the state lifestyle laws in Ohio actually requires officials to identify players and remove them from play. It was controversial, but that was one of the more recent laws, and it kind of took that next step of taking officials and making them, more about the safety, and in addition to, ensuring fair play. We have officials to kind of mediate and ensure fair play, and officiate and enforce the rules, so to speak. And as rules are developed with safety, I think, as Andy said, that becomes a growing responsibility. The other thing, too, is to remember, I guess, is that there is that variety. So every game at every level is officiated by people that are governed by different organizations. At the county level, at the state level, at sometimes even at the local organization level. So there's not a national standard. I think that was one of the things that we're encouraging, is that everyone be nationally certified. In some states, you can, if you're an official in one sport, you can take a test online and you can become an official in another sport. And that doesn't mean you've ever had to watch the game or been evaluated for your own field performance. So those types of things, I honestly think the people who care the most about the athletes are probably their parents, and if we can drive them to kind of be aware of what the situations are, it may, answer that question for a lot of people, could really help, I think, change youth sports for the better.
I was very intrigued by the study that you showed us, I think it was you, Andy, on the pilot project they've done in Nigeria. One of the things that has always interested me, especially because in our own family we've done much more basketball and soccer, is looking at ACL injuries. And it certainly seems to me that if you can teach athletes to fall better and how to take hits better, you can really minimize the energy that is going through their body.
Exactly. So one of our colleagues, Dr. Richard Hinton, talks a lot about what the human body was designed for, and much more for kind of long distance running rather than the short, quick change of direction, which we do in all of our field sports. Right. So we're not necessarily designed to make that quick pivot turn. And I think what a lot of these training programs are going for is to teach kids at younger and younger ages the movement patterns that would be safer. Mm-hmm. So whether that's how to fall correctly, how to make that turn, how to land correctly. It's actually pretty amazing to see jump landing patterns and how different it is for boys and girls. Mm-hmm. And so we think that may be part of the elevated risk for the girls is their landing patterns. But we want to do it at an age young enough so even though they may not be at high risk at those younger ages, they will have developed those patterns, those behavioral patterns, and use them when they do reach the higher risk periods of their adolescence.
So they can use them almost reflexively.
Exactly. So that's the idea. And there have been a number of studies which have shown it to be incredibly effective. So rates that tend to drop on the order of half for those who have gone through that training. So certainly no guarantee that they're not going to occur, but they're so devastating that it is a substantial savings of health, safety, expense.
Well, especially, and again, my own interest happens to be the lower extremity, but if you can prevent people getting hit on a planted foot, you can prevent a lot of the ACL injuries.
Right, especially for the women's games, and not just lacrosse, but soccer, basketball. It's the non-contact injuries that are much more prevalent for ACL injury to occur. So I think the contact or the impending contact, this perturbation of movement is what often throws us off. So even if it's trying to avoid the hit or moving in an awkward way, which oftentimes puts us at risk for that kind of injury.
Do we have any other questions? Well, I think our time is up, and I appreciate you all being here today, and I'm sure that there have been a lot of people watching online, and I hope this is only the beginning of many discussions, and in fact, you both will be out of jobs in 10 years because the problems will be solved. So thank you very much, and I do invite everyone to join us again next month for public health advocacy. Thanks.